If you have hip arthritis, finding the right exercises can feel overwhelming. With so many exercises out there and limited time to do them, how do you know which ones will help? In this video, I'll share my top 3 stretches and top 3 strengthening exercises that I've seen work best in my 16 years as a physical therapist. These exercises are designed to relieve pain, improve your strength, and help you move better. So let's jump right in. We'll start with stretches, and the first 2 stretches will be sitting down. Many people with hip arthritis lose the ability to lift their leg up this way, and that can either be due to pinching in the groin or stiffness in the back of the hip. So this first exercise will be a stretch for the muscles in the back of the hip, particularly the piriformis. To do this exercise, you'll cross one ankle over the opposite knee, and if you can't get it there on your own, it is okay to use your hands to help lift up and place it there. Then allow your knee to drop down as much as you feel comfortable going. If you feel a stretch in the back of the hip just doing this, that's enough. But if you need a little bit extra, you can apply some overpressure with your hand or lean forwards like this until you do feel a stretch in the back part of the hip. And then hold this position for 1 minute. Now, if you can't quite get your leg crossed over even using your hands, it is okay to modify by putting this leg straight, dragging it up as far as you feel comfortable going, and then leaning forward and doing the stretch there. Now, note that some people may also feel this stretch not just in the back of the hip, but also in the groin or inner thigh. And that's because the inner thigh muscles or hip adductor muscles often get stiff in people with hip arthritis as well. And so this next exercise will be a stretch for the hip adductors that focuses on the adductors a little bit more than that first exercise. For this one, you'll scoot all the way back into a chair like this, and then try to spread your legs out as wide as you can. Then if you need a little bit more stretch, just lean forwards on the chair. That uses the chair to help pry your legs outwards, and go until you feel a comfortable stretch in the groin. And then again, just hold this position for about a minute. Now for the third exercise, we'll move up to a standing position. And this is going to be a stretch for your hip flexor muscles, the muscles in front of your hip. This is important because you need to be able to extend your hip when you're taking a step to walk. And so for this one, we're going to stagger the legs like this, roll the pelvis underneath the view, and then squeeze your glute muscle here to drive your hips forward. Note that you don't want to arch your lower back like that, so make sure you keep your lower back in a relatively neutral position. Push off the toes, drive forwards with your glutes here. So this is a little bit of a strengthening exercise as well, and you should feel a stretch in the front of your thigh. That stretches out your hip flexors, particularly your iliopsoas muscle, which attaches to your spine. Now, it doesn't quite stretch out your other hip flexor, your rectus femoris. To really do that, you would kneel down on the floor in the same position and drive your hips forward. But many people with hip arthritis have trouble getting up or down from the floor and/or can't kneel. And for most purposes, doing the standing version works pretty well, particularly since it's very functional in the position of walking. So those were the stretching exercises. Next, we'll move on to the strengthening exercises. And the number one most important strengthening exercise for people with hip arthritis is for the outside muscles on your hip, the gluteus medius and gluteus minimus. Those muscles help balance you on one leg so that you don't drop down like that and get pinching in the hip joint every time you take a step. So to do this, you'll stand on one leg and try to keep your belt level with the floor. So slowly lift this other leg up, and you don't want to allow your hip to drop. It may help to do this in front of a mirror so you can make sure you're keeping things level, and then try and balance on one leg for 10 seconds. Now, if you can't do that without allowing your pelvis to drop, or you just don't have the balance to do that, it is okay to hold on to something for balance and focus on squeezing your glute muscles or these muscles right on the side of your hip right there. Additionally, if you don't have something to hold on to, you can also leave your other toe touching lightly on the floor, and that's another way that you can work on this exercise as well. Try to hold for 10 seconds and work up to doing that for 10 repetitions. So that's the first strengthening exercise. For the second strengthening exercise, we'll sit back down. And I mentioned at the beginning that many people have difficulty lifting their leg up like this. For example, putting on shoes or socks or lifting their leg to get in the car. And so this next exercise will work on your hip flexor strength, and particularly in an above 90-degree position. To do this exercise, you'll take your hands and lift your leg up toward your chest as far as you can comfortably. It may be helpful to bring the knee slightly out to the side as well. You can usually get a little better range of motion out here than you can right in here. So bring the knee slightly out to the side, turn the ankle slightly inwards, and then hold the leg up here. Then try to let go with your hands. If you can't hold this position and keep the leg from dropping down, then use a little bit of gentle support from your fingers, just as much as you need to hold the leg up. And again, try and hold in that position for 10 seconds. Then slowly lower the leg back down. Lift back up using your hands. Lift it as high as you can go. And then try and hold in that position using your hands only as needed to keep it from dropping. Slowly lower back down after 10 seconds and repeat that one for 10 repetitions. The third exercise will be a lateral step up. And this is to help with the task of going up and down stairs. As an exercise, it often works better to face sideways to the stair rather than facing up or down the stair. To do this, you'll put your foot flat on the stair. Think about turning your knee out slightly. That activates your glute muscles. Then lean your trunk forwards. If you keep your trunk vertical, this becomes much more of a quadricep dominant exercise, which is okay, but for the purpose of hip arthritis, we want to focus on the glutes. So lean forward slightly. Think about driving your heel down into the floor, squeezing your glutes, and driving your hips underneath of you. So instead of thinking about straightening your knee, you want to think about pushing your hips forward and then coming back down. Push the hips forward, come back down slowly, push the hips forward, come back down slowly. Now note if I do this with the other side, you want to think about pushing through the heel, lifting up, and then try to touch your heel down first. If you touch your toe down first, you don't get as much of a range of motion. So try to lower your heel down to the floor. If you can, just lightly touch the heel and come back up. Lightly touch the heel, come back up. That keeps your glutes under tension the entire time. Now I'm showing this without holding on to something so that you can see the exercise better, but it is often helpful to hold on to something like a chair, either to the side of you like this, or if you're doing this on the bottom step of a staircase, hold on to the banister in front of you like that for balance. So those were the exercises, but just having strength and flexibility may not necessarily relieve hip arthritis if you don't incorporate those into your everyday activities like walking and climbing stairs. To learn how to do that, check out these videos over here. But before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.